Okay, we started? Okay, so this is for the yin meridians of the arm. The meridians that start in the chest and end on the hand. And the yin meridians of the arm are the lung, the pericardium, and the heart. So we're going to start like this. Oh, you can't help me now. I know you know, but can you? Okay, so we're going to start like this. We're going to do this stretch. And the stretch this way. Look at the hand, neutral position, right? And that when we're stretching, we don't want to be out here to stretch because then you're going to create lateral flexion. What you're trying to do is open this area where they all start, so it's just depression of the shoulder. So that means that the arm has to be towards the person and down. And you're doing it with your body weight. And you take all the slack out of their arm, and then you just slowly turn their palm up. And if there's some stuck fascia, which impedes the flow of the chi in the meridians, they're going to feel that.
Yes.
You're going to feel some fascial burning. Yes. And this simple thing makes your work so much easier because it's putting spatial integrity into the joints of the shoulder, of the elbow, of the wrist. It's also opening up the fascia that surrounds and in some cases impedes the flow of chi in the yin meridians along pericardium and heart. And then just release. Right. And now we're going to do a little mobilization. So I'm like this, and I'm going to come up inside knee, outside. No helping. We're going to do a little mobilization. So they start in and around here, right? So I'm going to stabilize that area and then mobilize. Because I'm stabilizing the beginning of the meridians and then I'm stretching the arm overhead to stretch the meridians. So a nice mobilization. All right. I'm also going to do a stretch to the side. Open up the joints here. So this is just to stabilize the body so she doesn't come. Stabilizing. And the arm is coming out at a right angle. Stretching. Right? Now sometimes I'll just go like this just so I can stabilize the head. And pull
That
right
felt good.
Okay, so that's a nice stretch. Because you want to do a certain amount of stretching and compression, and then we're going to thumb the meridians. But you want to open up the area. You want to make it as plump as possible so that you can get in there. So the nice stretch, right? And now we're going to do a little compression. So arm out. So the meridians start here. So my compression is going to start here and come out to the hand. So I'm just going to start, and I'm going to be like this so I can use my body weight, and I'm just going to sink in and compress. And the meridians come on either side of the bicep and through the bicep. So I'm going to compress the whole thing with my hands. Just compress like this. Just a nice compression. I'm going to bring the arm up so I can compress down right into the bicep. So you want to compress the whole thing. I want to stabilize here and pull the arm down like this and fascially unwind the bicep. Feels okay? See what I'm doing? I'm pinning, keeping a pin, and then I'm pulling this arm down. That unwinds that arm. Okay? We're going to come to the forearm. And what I'm going to do is use my outside knee and just come squishing out down. Okay, Pen? And I'm working out towards the wrist. Now, you can compress like this, sure. You can compress like this, sure. You can compress like this, sure. Same, but you need to compress. So compress we must. And when you're compressing, no matter what you're using, you don't want to compress directly on here, but just below it, the wrist crease. And then you can come and work like this, right? Through the wrist crease. You're hitting all the source points, right? I'm going to press up into the joint to open it up a little bit. So my hands are behind here, supporting, and my thumbs are going to push up into the joint. Just to create a little space there. Okay? And compressing into the hand. So when we're doing the lung meridian, I want you to feel for the clavicle. I want you to go below the clavicle and apply a little thumb pressure. And then the lung meridian comes and follows the front contour of the anterior bicep. So you're going to press right into that contour. And then the meridian comes in between this groove of the bicep and the tricep. So right in here. That the meridian comes right on the inside of the brachioradialis. This is the lung meridian still. So you can press right into the lateral border, or the medial border rather. And it comes right to the wrist crease, and that's where the source point is. Lung. And then you continue thumbing right through the thenar eminence, the pad of the thumb, and right out the inner side of the thumb to the nail. That's lung meridian. Okay. Pericardium meridian starts about the mid point of the attachment of pec major on the side of the body, in between the rib. I don't know if there's a little sensitivity there or not. Not much.
Not much. Well, no, there is.
Okay, that was one too low.
Yeah.
So then the meridian comes up and follows, excuse me while I do this, follows the contour of the pec major, right? And you follow that pec major and it takes you right between the heads of the bicep. So if you squeeze the bicep and you sink right in the middle, you go right into the split between the heads, right down to the bone. That's where the pericardium meridian goes. So it's right through the head there. And then it goes right through the center of the forearm, between the radius and the ulna. And the source point is at the wrist crease. Right, that's pericardium. And then the meridian continues right into the center of the palm, pericardium 8, and right out to the tip of the middle finger for pericardium 9. And that's the end of the pericardium meridian. And the last yin meridian of the arm is the heart meridian. And it starts in the armpit. They usually don't needle that nor stick your finger in there. But you can use the side of your foot to come in and pull against it. And that gets the heart meridian. And then the meridian itself comes out of the armpit and comes into this groove between the bicep and the tricep on the little pinky side. So if you just thumb this line coming out of the armpit, and remember this is the anatomical position, so yin goes up, and it comes right on the soft portion of the arm, and it goes right to the wrist crease for heart meridian. And then it comes up onto the palm in between the 4th and 5th metacarpal. And it comes right on the inside of the little finger. Ends at the lower portion of the nail. So that's the 3 pathways of the yin meridians of the arm: lung, pericardium, and heart. Okay? Okay, that's enough.